In this video, I'm going to talk about the glossopharyngeal nerve, the origin, the course, and the branches. In the previous video, we talked about the cranial nerves in general and where they arise from. And we mentioned a rule that's called the 2-2-4-4. And this means 2 nerves coming from the cerebrum and 2 nerves coming from the midbrain and 4 nerves coming from the pons and other 4 nerves coming from the medulla oblongata. The last 4 nerves will be the 9, 10, 11, and 12. As you can see here on this side, this is the medulla oblongata. And by definition, the first nerve to arise from it is going to be the glossopharyngeal nerve. And then you will have the vagus nerve after that. So if we go to the mark here, 15, glossopharyngeal nerve nucleus, which is the inferior salivatory nucleus, which is the origin for the glossopharyngeal nerve. And then number 14, of course, is going to be the glossopharyngeal nerve. And number 12, or this nerve, is the vagus nerve. And they exit the cranial cavity together through a foramen called the jugular foramen. So 13 is the jugular foramen. The glossopharyngeal nerve will go down and give multiple branches. And most importantly, I'm talking here about 3 branches at the end. You can see one of these branches is going to a single muscle on this side, and 3 other branches, or about 4 branches, going into the pharynx. As you can see here, all these branches. And finally, another branch going toward the carotid artery. The branches going toward the so-called the pharyngeal branches. Branches going toward the carotid artery is called the carotid branch of the glossopharyngeal nerve. And the branch that's going to this muscle, this is the stylo process, and this is the pharynx. It's called the stylopharyngeus muscle. So this nerve is called the stylopharyngeus branch of the glossopharyngeal nerve. All right? So to summarize, you have the glossopharyngeal nerve coming from the inferior salivatory nucleus, and it also leaves the brainstem through the anterior surface or anterolateral surface of the medulla oblongata. It goes down and exits the cranial cavities through the jugular foramen in companion with the vagus nerve, and then it gives you 3 terminal branches. This is the branch to the stylopharyngeus muscle, the pharyngeal branches, and also the carotid branch.